Hi friends, welcome to the Jellyfish. Today let's see the important questions that is related to the CPR. So what are the questions for BLS and CPR? Let's see. The first question, the site of chest compression in an adult is option A, upper border of sternum, option B, lower half of sternum, option C, left side of chest, option D, right side of chest. Usually where you are going to do the CPR. So we are going to do in between the chest letters. So what is the correct answer? Yeah, guess it. Answer B is a correct answer. Next question. The sequence of events that take place in the heart during a complete heartbeat is called it as option A, stroke volume, option B, cardiac output, option C, cardiac cycle, option D, peripheral resistance. So can you guess it that what could be the correct answer? The sequence of events takes place in the complete, that is full cycle it is going to be. So answer is option C, cardiac cycle is a correct answer. Okay, fine. Next question. In the following condition, the heart muscles trembles rapidly in an unsynchronized manner. So option A, premature ventricular contraction, option B, ventricular fibrillation, option C, pulseless ventricular bradycardia, option D, sinus rhythm. Usually where it was happen in it? Usually in the sinus bradycardia. So what could be the correct answer? Yeah, answer is a correct answer. Next question. The following are the chambers of the heart except option A, right and left atrium, option B, right ventricle, option C, left ventricle, option D, lateral ventricle. So you know that it is, what is that? Right atrium, left atrium, right ventricle and left ventricle. So what could be the correct answer then? Answer is option D, lateral ventricle, correct answer, because the question is except. Okay, fine. Next question. The chance of survival of a patient who has received CPR, a defibrillator and early advanced care. So when you are going to give the CPR, early advanced care, if you are giving, what is the chance of survival rate? So option A, 30%, option B, 40%, option C, 50%, option D, 60%. So what could be the correct answer? Can you guys say that? Yeah, answer D is a correct answer because the survival rate is somewhat it is. Okay, fine. Next question. The use of manual resuscitators to ventilate a patient is known as. So can you read the question? Manual resuscitator to ventilate a patient is known as. Okay, fine. Option A, backing. Option B, mouth to mouth respiration. Option C, masking. Option D, resuscitation. So actually the question is manual resuscitation. What is that? Yeah, that is amber bag. So A, backing is a correct answer. Okay, next question. The interruption between chest compression should be option A, more than 10 seconds, option B, less than 10 seconds, option C, less than 20 seconds, option D, less than 50 seconds. So what could be the correct answer? Yeah, usually we are going to do the interruption is less than 10 seconds. So what could be the correct answer? Option B, less than 10 seconds is a correct answer. Okay, fine. Next question. The rate of chest compression per minute for an adult is option A, 80 to 100 per minute, option B, 120 to 130 per minute, option C, 70 to 100 per minute, option D, 100 to 120 minute. So what is the correct answer? Can you say that? Yeah, the correct answer is option D, 100 to 120 per minute. We are going to give a compression as 100 to 120 per minute. Okay, fine. Next question. The percentage of oxygen delivered through back wall mask is option A 100%, option B 21%, option C 33%, option D 78%. So what is the correct answer? When you are giving back valve mask, how much we are going to do? So 92, 95%. So what would be the correct answer here? Yeah, option A 100% is the correct answer. Next question. In the ECG, the first upward deflection after the P wave is, so where? So option A Q wave, option B R wave, option C T wave, option D S wave. Yeah, what could be the correct answer? We are getting the P, next wave is what is that? R wave. That is a correct answer. That means option B is a correct answer. Next question. The following additional equipment are available in the AED kit except option A ambu bag, option B gloves, option C razor, option D pocket mask. The additional equipment are available in the AED kit except, that is option A ambu bag is a correct answer. Okay, fine. Because gloves, razor, pocket mask, everything is there in the AED mask. That's why it is A is a correct answer. Next question. The abbreviation for AED is option A automated external defibrillator, option B automated external defibrillator, option C advanced external defibrillator, option D automated external diffuser. So what is the correct answer? Can you guess that? Yeah, you know everything. That is option A automated external defibrillator is a correct answer. Next question. The link in the chain of survival of an adult who suffers a cardiac arrest in hospital, including the following. That except option A surveillance, prevention and treatment of pre-arrest condition, option B immediate recognition of cardiac arrest, early CPR, option D activation of EES. So what could be the correct answer? When you are going to chain of survival in the cardiac arrest in a hospital, what you are going to do? So that is a question. So that means immediate recognition of cardiac arrest, early CPR, activation of EES is a, that is chain of survival. So okay, fine. The except is, what is the question? That is except. So option A is a correct answer. Okay, fine. Next question. The division of the lungs into the segments based on the territory or segmental bronchi is known as, what is that? Okay, option A bronchopulmonary segment, option B bronchiole pulmonary segment, option C bronchiole segment, option D tracheal segment. So actually the question is the division of lung into the segment based on the territory. So what could be the correct answer? Yeah, answer option A bronchopulmonary is a correct answer. Okay, fine. Next question. The middle part of the pharynx behind the mouth is option A laryngopharynx, option B nasopharynx, option C nasal concave, option D oropharynx. So what would be the correct answer? Middle part of the pharynx behind the mouth. The question is behind the mouth. So what could be the correct answer? Can you guess it that? Yeah, option D oropharynx is the correct answer. Next question. The pocket mask should be positioned on the victim face. And option A only over the nasal cavity, option B over the mouth completely, option C using bridge of the nose as a guide, option D outer side of the mask covering corner of the mouth it is. So what could be the correct answer? Yeah, the answer is option B is a correct answer. Next question. To locate the femoral artery in a child Place two fingers in the option A inner thigh midway between the hip bone and pubic bone. Option B outer thigh between hip bone and pubic bone. Option C midway between hip bone and knee. Option D over lateral aspect of thigh it is. Usually where you are going to locate the femoral artery pulse it is, that is in between the. So option A inner thigh midway between the hip bone and pubic bone is a correct answer. Next question. The cardiopulmonary resuscitation must be initiated on an unresponsive infant if there is no pulse or the pulse less than. So option A 40 per minute, option B 80 per minute, option C 100 per minute, option D 60 per minute. What is the correct answer? Can you guess it that? The correct answer is option D 60 per minute is a correct answer. Okay, fine. See, don't forget to subscribe my channel, and also so many BLS videos and CNE videos also available and quiz also. So you watch this video. Okay, fine. Next question. A rescuer has applied an AED pad to the victim in cardiac arrest. The appropriate action to take when the AED analyze the heart rate rhythm, or option A check the carotid pulse simultaneously. Option B stand clear of the victim. Option C give rescue breath only. Option D continuous chest compression. So whenever the AED analyze the heart rhythm means what is going to do? Option B stand clear of the victim is a correct answer. We are going to tell the stand clear. Next question. While performing a hemiplegic maneuver, the direction of the thrust performed should be option A upward, option B inward, option C downward, option D as per convenience of the victim. So actually what we are going to do this inward and upward direction. So what would be the correct answer? That is answer A upward is a correct answer. So then only what is inside the mouth it will come out. Okay, fine. Next question. The following are the roles of the timer are recorded except option A records medication, option B record frequency and interruption of compression, option C record time of intervention, option D makes treatment decisions. So what could be the correct answer? Actually the recorder, what you are going to do this, the role is except they are asked. That means what is that? Make treatment decision. So that will be the correct answer. Next question. The carotid pulse can be assessed in option A children, option B adults, option C adult and children, option D infant. So whom we are going to do assess? All persons, adult and children, all the person we are going to assess the carotid pulse. Okay, fine. Next question. At the end of each chest compression, the rescuer must option A straighten the arms, option B minimize interruption, option C initiate breathing, option D allow the chest to recoil. So actually what we are going to do the end of the each compression, they give us to do the what is that? Option C initiate the breathing is a correct answer. Okay, fine. So next question. The right atrium receives blood from the option A pulmonary artery, option B pulmonary vein, option C superior and inferior vena cava, option D aorta. Usually what is that? Pulmonary artery and pulmonary related to the lungs is going to carry the blood by the pulmonary vein and it's going to spread to the other part of the body by the help of artery and aortitis. So what is the correct answer? You know that it is all part of the body, it is going to collect by the superior and inferior vena cava. So answer C is a correct answer. Next question. A 23-year-old man was strangled in a restaurant and suddenly became unresponsive. The rescuer who witnessed the scene lay him down and perform CPR for 2 minutes. After 2 minutes CPR resuscitation, the rescuer should option A, check pulse, option B, check respiration, option C, activate the emergency response system, option D, look for the foreign object in the mouth it is. So the patient is, what is the question? That is strangled in a restaurant. So what could be do you have to do the after CPR? Yeah, you have to be activate the emergency response system it is. Okay, option C is a correct answer. Okay, fine. Next question. A nurse demonstrates the technique of two rescuer back mask ventilation to do junior nurse. The nurse explained that the role of the first rescuer is to option A, provide compression, option B, lift the head and tilt the chin, option C, squeeze the back, option D, use both hand to seal the mask it is. So what should you have to do that? Yeah, when you are going to do the use both hands to seal the mask, that could be the correct answer, option D. Okay, fine. Next question. A 7-year-old child become unresponsive. Second nurses witness the situation. The first rescuer attempt CPR while the second maneuver. Option A, give breaths. Option B, access the child. Option C, counsel the parents. Option D, retrieve the AED. So what could be the correct answer for the second rescuer? Option D, retrieve the AED is a correct answer. Next question. A victim has a mild airway obstruction and the neighborhood nurses call for help. The nurse observes the victim and encourages him to cough. Over time, the nurse noticed that the victim is making high-pitched noise when inhaling, is unable to speak and is constricting his throat. So the nurse immediate action would be option A, activate the emergency response system. Option B, perform abdominal thrust. Option C, initiate CPR. Option D, monitor the vital signs. So what could be the correct answer? Yeah, whenever the obstruction has come, you are going to give the abdominal thrust test. So that will be the correct answer. A 58-year-old man suddenly collapsed in a grocery store. The rescuer arrived with an AED and was in the process of applying AED pad. The rescuer found a medicated patch over the victim's chest. The rescuer should option A, attach the AED pad, cover the medication patch. Option B, attach the AED pad 5 cm below the medication patch. Option C, remove the medication patch and attach the AED pad immediately. Remove the option D, remove the medication patch, wipe the area attached with the AED pad. What would be the correct answer? Option D, remove the medication patch and wipe the area and attach the AED pad is a correct answer. I think you have understood all the question and answer. If you want any other BLS or CNE questions, you can watch the videos in other playlist. Okay, thank you for watching. Kindly subscribe my channel also.